My name is Rachel Wurth. I'm a fifth year PhD candidate at Mayo Clinic in the Graduate School of Biomedical Sciences. So, through support from the Rosenau Family Research Foundation, my grant aims to ultimately try to discover new biomarkers that will complement current clinical diagnostic testing for Krabbe disease. And so I use residual samples that are left over from our lab. That includes plasma, dried blood spots, cerebrospinal fluid, after they've finished performing the clinical quantitative cytosine testing. Whatever's left over, I use and I put that to an untargeted metabolomics method that I developed for the lab. And basically, what this method allows us to do is to detect many metabolites at once in a sample and use that to try to see if there are new biomarkers for Krabbe disease that could help in the diagnosis or prognostic monitoring. And then another part of the project is to look more at the mechanism of Krabbe disease. So I have a couple patient-derived fibroblast cell lines that I'll be using, and we'll be doing metabolic flux study with that. So while metabolomics gives us the pinpoint picture at that particular time in the sample of metabolites that are present, flux allows us to see how pathways are being utilized in real time and see if there are any differences between disease and then wild type fibroblast. So I heard about the grant program through one of the co-directors of my lab that I'm doing research in, which is the biochemical genetics lab at Mayo. And it was Dr. Dieter Matern who mentioned it to me after I decided that I would focus my research on Krabbe disease. And it's really uncommon to find grant mechanisms that a PhD student can apply for themselves. Usually, my mentor would have to be the one that would be the principal investigator of the grant, and it would be submitted under him. So I really appreciate that the Rosenau Family Research Foundation recognizes this and how they've structured the new investigator grant so that PhD students can have the opportunity to have some ownership over their project as the principal investigator. I actually started in rare disease a little bit before I went to graduate school. I did a research fellowship at the National Institute of Child Health and Human Development, and my lab there was run by Dr. Konstantin Stratakis, and it was the section on genetics and endocrinology. So I was trying to work on developing a blood test that would help us detect pathogenic variants, the most common pathogenic disease-causing variant for a disease called primary aldosteronism. And then when I came to graduate school and decided that I would be doing untargeted metabolomics of inborn errors in metabolism, but didn't know what disease to focus on yet, I was really inspired by my lab's ongoing efforts and dedication to improving the diagnosis of Krabbe disease, and also reading some stories of how these babies just happen to be in the right state at the right time to receive a diagnosis and be able to get life-saving treatment. It really just highlighted the need for me to investigate for novel biomarkers for this disease in particular. I think what really gives me hope is first seeing that infantile Krabbe disease has been added to the recommended uniform newborn screening panel. I think that this is really a step in the right direction, and it honestly couldn't have happened at a better time for my research project because it really highlighted the need that, okay, infantile Krabbe disease has been added, but what about the other forms of disease? And can we continue to build our research for later onset Krabbe disease and try to promote those forms being added to screening in the future? And then another thing too is just seeing the progress of other researchers in the space, seeing them present in conferences or reading in manuscripts. There's a real sense of dedication to trying to improve outcomes for patients with Krabbe disease in the field, and that really inspires me to continue my research. I think the best part for me is really the conversations that I get to have with other researchers in the space. I always leave those conversations really excited about my project. and like with fresh perspectives and just feeling like extra motivated after having those conversations with people who are familiar with the challenges, but also the opportunities in this research field. And I think the most challenging part about being a PhD student for me is the process of becoming an independent scientist. I'm lucky I have a really great supportive mentorship team. I know I can turn to them at any time and they'll be there to help me. But part of getting a PhD is learning how to develop your own independent line of thinking as a scientist yourself. And in the beginning, that was really overwhelming because I was just getting familiar with the research and the field in general. And it's still overwhelming. It probably will be for some time as I continue to progress through the early stages of my career. Um, but just learning how to advocate for myself when I need support and breaking down tasks into more manageable day to day achievements has helped me with that. I feel like what I would advise students that are considering getting into rare disease research specifically is that it can be really rewarding. I think the sense of community is really strong in rare disease research because there's a close knit group of scientists that you really get to know well. You get to see their research progress over the years and get to develop more personal relationships with those scientists over time. And also, another thing that I've learned while I've been in this space too is that a lot of the advocacy work comes from family members who have been personally affected by the disease. And I find it really inspiring to see how much they are able to achieve in terms of advancing testing and also research efforts forward for a disease that they've been personally impacted by. And it really inspires me as a scientist who's in the lab. I don't see patients on a day to day basis. It can be easy to lose track of the bigger picture. But I think it's more difficult to do that when you're in the rare disease space because you're more constantly confronted with the efforts that people are putting forward to improve outcomes for these patients. And I think that makes me a better scientist in general. If I had to give any advice for anyone who's like in a PhD program, maybe, or like very early in their career, thinking about something I wish I had put more effort into, it's just like the professional networking with other scientists in your field is so important, not only for just like future collaborations or like potential job opportunities in the future, but just being like more involved in the research space, like having that network of scientists that you can connect with is so important. One hobby that I've really gotten into probably over the past like 5 years or so has been mountain biking. So there's actually a set of trails that's really close to where I live in Rochester, and I try to get out there a lot in the summer and fall and ride my full suspension mountain bike that I bought right at the beginning of grad school. It's a great way to de-stress and get outside and get some fresh air and have some fun.